Good morning, ladies and gentlemen. Welcome to the program agenda. I'm your host, Cito Beltran, broadcasting live from Barrio Capitolio here in Pasig City. Umuwi muna po tayo at maraming kailangang harapin sa Metro Manila. Kasama na ang polusyon, ang traffic, at ang mga pangyayari dito. Okay, so February 8, 2023. It's a Wednesday. It's midweek, and I do hope that whatever agenda you had for this week, you are halfway through there, if not finished. And today, we are going to be talking about a particular topic. In case you're wondering, bakit naka-pink si Cito? Well, I don't know unless they change the color. Baka out of fashion na ako and not up to date. But pink is the color I've always associated with cancer. Cancer has visited my family, my sister. So it is near, it is one of those diseases that are top of mind. And we will be discussing that. But it's going to be an interesting discussion because not only will we be talking about oncology or the science of cancer, but also about radiology in relation or radiation treatments, because I think that is one of the boogeymen or the things that people wonder about when they hear the talk of cancer. But before we do that, let's go to our daily starter. And it comes from Nelson Mandela. And I got this from a documentary. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will ultimately determine the significance of the life we lived. And if I may, Gab, do not remove the graphics. I want to repeat that. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will ultimately determine the significance of the life we live. Some people have told me, pare, pakinggan mo yung salitang history. It is not about the past. It is your story told in the lives of others, your children, your friends, your community, and your country. So, whatever profession you are, kahit napakasimpleng tao, yung mga magbubukid, yung mga katulong natin kasambahay, they may not have titles, but they make a difference in our lives. Many of us cannot run a country if the maid or the laundry woman does not wash her clothes. Many of us cannot go to the office unless someone looks after your children or grandchildren. So we all play a role, ika nga nila. So it is what makes our life significant is the difference we make in improving the lives of others. Okay, let's now go to the front page of the Philippine Star for a quick review of the news. And as expected, tell us something we don't already know. Nauna na ang mga housewives at mga mister tungkol sa economic projections. Matagal na naming alam itong headline na ito. Inflation sizzles to 8.7%. Okay? January numbers unfortunate according to Bongbong Marcos. Yan po, no? Tumaas po, lumabas pong mas mataas. It turns out that inflation was much higher than all the experts projected, than all the businessmen had prayed and hoped for, and it is as high as all the housewives knew. Okay? Kumbaga, napakaklaro po niyan. Inflation in the country accelerated in January, hitting its highest rate in more than 14 years and exceeding projections and market expectations due largely to higher housing and utility costs and food prices. Okay, moving up to the front, on the header of the front page. Very good. BBM satisfaction rating, excellent for Sara. A majority of Filipinos are satisfied with the performance of President Marcos and Vice President Sara Duterte in their first 6 months in office, according to a survey conducted by the Social Weather Station. Okay, po, no, the satisfaction rating of the two highest officials were among the data presented during the 2023 SWS survey review held by the Asian Institute of Management in Makati yesterday. Bahala na po kayo kung ano ang reaction nyo dyan sa survey na yan. And let's now go to other news at the top left of the front page. President Marcos and Bureau of Internal Revenue Commissioner Romeo Lumagi forming the heart sign during the kick-off of the national tax campaign at PICC. Pay the right taxes, Marcos urges public. Di na po tayo mag-editorialize kasi alam ko mayroong isang pamilya dan, malaki pa ang utang sa BIR. Okay, so yun. Meanwhile, sad photo taken from Turkey. Hatay, Turkey residents look at a collapsed building as rescuers search for survivors in the rubble yesterday, where an estimated 5,000 people have died from that massive earthquake in Turkey and in Syria. Pagdasal po natin sila dahil talagang malamig. Kikita nyo naman, balot na balot ang mga tao doon. They are really going through a cold winter and it is hard to have to deal with those two challenges. Meanwhile, the Philippines is sending an 85-person rescue team. Malamang all-men yan kasi worse than a battle zone po. Iyang lugar na kung saan 5,000 na ang patay. Parang Yolanda. At least doon, alam na nila kagad na 5,000 ang patay, hindi pinagtatalunan. The Philippines will is sending an 85-member team to earthquake-ravaged Turkey to help in search and rescue operations after the Turkish ambassador requested assistance for emergency medical assistance as well as search and rescue experts. Okay, so yan po, no? And 35 Philippine doctors to undergo 21-day training for forensic pathology. Okay, yan po. The Department of Justice has reached an agreement with the United Nations Special Rapporteur Maurice Tidball-Binns for a 21-day training exercise in forensic pathology for at least 35 Filipino doctors as part of the DOJ's program to improve capabilities for investigating wrongful deaths in the country. Siguro, ang isa pang dapat gawin ni Secretary Remulla ay hindi lang improvein yung capability ng mga doktor, gawing independent unit outside of the PNP, yung mga forensics na yan. Kasi kung puro kabaro, kabats, ka-uniforme rin, ang magdodoktor-doktor, problema yan. Nape-pressure po yung mga doktor ng mga taong may mga baril. Okay, meantime, photo there, shoppers pose for photos at the SM Seaside in Cebu. Okay, sa Cebu po yan. in their latest attraction, Lovescape, a larger-than-life interactive display of multi-sensory experiences. Lovescape and other love-themed activities are part of SM Supermall's offerings in the days leading to Valentine's Day. And last but not the least, President Bongbong Marcos flies off to Japan today with First Lady Liza Araneta and a full force. Kumbaga, yung kanyang buong team, okay, ay kasama niya from the Speaker of the House, members of the Senate, Senate President Zubiri, cabinet officials, and also former President Gloria Macapagal Arroyo. So ayun po, yun na. That's the news for today. And I will just check if we are going to go for a break. But as mentioned earlier, we are going to talk about cancer. And we are going to feature our friends from the Rizal Medical Center, mga kapitbahay ko po. At malaki, one of the best, fastest improved public hospitals I have personally witnessed in so many decades. Okay, let's now roll out the video for our first guest. Or pareho na raw sila.
Dr. Marigold Ferrolino is the head of the Oncology Center of the Rizal Medical Center. Ferrolino is also a visiting consultant at the Philippine Heart Center and Fatima University Medical Center. Dr. Antonio Alonzo is a radiation oncologist at the Rizal Medical Center, Lung Center of the Philippines, and Manila Medical Center.
Okay, good morning, Dr. Ferrolino, Marigold Ferrolino, and Dr. Antonio Alonzo. Thank you for making time for the program agenda this morning.
Good morning, Cito, and also to our televiewers and listeners. Thank you for having us here once again.
Dr. Alonzo, good morning to you.
Good morning, Cito, Sir Cito. Good morning.
Okay. Medyo lalakasan, pasisigawin ko si Dr. Alonzo mamaya. Okay. Anyway, Doc Marigold, good morning. And as you probably heard in my intro, cancer is something that is always on my mind, knowing that my sister had it, a very good friend of mine has had it. I'm hoping it doesn't come back again. Am I correct? Parang cancer month din yata itong February ba? Kasi lagi sinasabi heart month pero nakakalimutan yung cancer month.
Yes, our guesting today is very timely because today, actually this month is the International Cancer Awareness Month. And we recently celebrated the World Cancer Day last February 4.
Okay, so February 4 pala yung World Cancer Day. Okay, now, what is our situation? It seems more optimistic because I remember back in the day, pag sinabihan ang babae na meron siyang breast cancer o kaya cancer in their reproductive area, etc. Medyo parang black or white lang ang labanan. But I know so many cancer survivors now. What is the state of cancer medicine, Dr. Marigold?
Actually, right now, we have been seeing a lot of survivals. So, longer na yung survival ng cancer, especially breast cancer patients, because we already have a lot of chemotherapy drugs that are advanced, like targeted treatments and even immunotherapy. So, this has really significantly extended the survival even among stage 4 or metastatic breast cancer patients. So, maganda naman po yung maganda naman yung very promising.
Okay. And
treatment.
What is the most common form of cancer nowadays?
Actually, ever since, it's still breast cancer. So in the top 5 cancers in the Philippines, number 1 is still breast. Second is lung cancer. Third is colorectal. So breast cancer pa rin. In Asia, in Southeast Asia, I think Philippines ranks number 1 in breast cancer incidence.
Is there any guess, if I'm sabihin ko na lang guess, kasi talaga ang hirap i-figure out yung cancer na yan. What is the reason why the Philippines ranks highest in breast cancer in Asia? I mean, I remember one time, Dr. Ferrolino, someone wrote an article parang making an association between dairy products and breast cancer kasi sabi nila, hindi naman talaga normal para sa tao uminom ng ganito or kumain ng ganyan. What could possibly be causing that among Filipinos? Filipino women?
Actually, I think the incidence increased because we have more detection. So kung mas maraming madedetect, tataas din yung incidence. Aside from that, I think Filipino women are more career-oriented nowadays. So parang sinasantabi nila yung pag-aasawa and pregnancy. And one of the risk factors for breast cancer is actually having pregnancy late. So later, 35 years old and above, or not having children at all. Aside from the fact that some breast cancers can be also genetic. So it can also run in the family. It can be familial. So I don't think the dairy products, there's no really evidence in that it is associated. However, obesity is generally can be associated with breast cancer and other fat-related cancers like colorectal. Basically because when you are obese, you are prone to develop more hormones because hormones are produced from cholesterol or fat. So pero hindi naman talaga yung dairy products, it's not really an evidence-based cause of breast cancer.
So wala yun, medyo guess. Hula-hula pa yun.
Yes.
Now, but you're talking about colorectal kasi sa totoo lang, yan ang isang bagay na ayaw pag-usapan ng marami, whether male or female. Kasi pag sinabi mo ng colorectal, eto na, yung colonoscopy na yan, sundot sa puwet, as they would always say. But what is the percentage of colorectal cancer in the Philippines, and how serious is it?
As I said earlier, colorectal ranks number 3 in incidence. And that is for both men and women yun, pareho yun ang incidence. And actually, it's one of the preventable cancers that we have. So you can actually detect it by early screening. And one of the screening, as you mentioned, is colonoscopy. So the recommendation right now is to have colonoscopy starting at the age of 50 years old. But if it is normal, you may not do it annually, every 3 or 5 years pa thereafter. So hindi naman talaga yun masakit, no, kasi meron namang anesthesia and so on. So prevention is still better than cure. And actually, when you are able to detect it early, you have higher survival, and that improves the survival rate of these cancers.
Okay, now you mentioned that lung cancer is the second highest case in the country. Is it still cigarette related, or ano na ba siya? Is it now also because of pollution, genetics, etc.?
Lung cancer is still cigarette related, no? So more environmental siya, no? So only a portion of lung cancer, like small cell, can be genetic, but generally because of exposure to smoke. Not just smoking, active smoking, but we have such a thing as passive smoking or secondhand smoking. So kung hindi ka nagsusmoke, pero yung asawa mo nagsusmoke, you get to inhale also the smoke from the cigarette. You too can develop lung cancer. Actually, we have a lot of patients na asawa lang nila yung nagsusmoke, pero they end up having lung cancer as well. So merong first hand,
paano
second
yung
hand.
sa mga bata, Dr. Ferrolino? Kasi ang dami ko nang nakikita niyan, at least before COVID-19, makikita mo they're in the cars, nagsisigarilyo, may bata sa loob ng kotse, etc.
Yes, they may also be affected, but usually it parang develops later in life. Pero kung they are constantly exposed to that, they may develop also lung cancer early. We have seen patients also having lung cancer ng bata pa, ha? May mga 20s and 30s. Pero very uncommon yon.
Okay. Let me just go to Dr. Alonzo kasi hindi ko nga alam, para akong namimili sa dalawang tulay dito. Very interesting also, Doc Alonzo. You're a radiation oncologist. Now,
Yes.
can you explain what exactly your line of work is? Kasi alam mo, ang alam ng karamihan tao yung X-ray technician, yung mga ganun, medtech, pero radiation oncologist.
Yes, as a radiation oncologist, we are part of the team treating cancer. Sa linya namin, like Dr. Goldie before me, she is a medical oncologist. She uses medicine and chemotherapy to treat cancer. And we as radiation oncologists, we use radiation, X-rays, high energy X-rays to treat cancer naman. So we are a team. We are a team including the surgeons, the palliative doctors, the anesthesiologists, and as a large institution as Rizal Medical Center, we practice the world gold standard in managing cancer using a multidisciplinary team or an MDT. So parang magkakasama kami lagi. No one doctor treats cancer alone. So in our case, no man is an island. We have to talk with the medical oncologists. We have to talk with the surgeons. We have to talk to the palliation and the anesthesiologists in managing cancer patients.
Yeah, I remember when my sister underwent that challenge. She had, ang tawag nga niya, I have my team. Sabi ko, anong team? I have my team of medical experts taking care of me. Kasi yun nga, I think she had a 7 or an 8 per doctor team. Now, Doc Alonzo, itong radiation, because most people don't really know what sort of radiation treatments and why they use radiation, etc., for dealing with cancer. First, why is it done? How is it done? What are the types of treatments done? Kasi pag sinabi mong X-ray, nung bata ako, veterano ko sa X-ray, nung nabali yung likod ko. Pero yun, X-ray lang para makita yung buto. Ngayon iba na eh.
To put it, ilalagay ko na siguro ito sa layman's word. So, example, Goldie treats cancer using chemotherapy. In our part, we use to treat cancer using radiation. So most of the time, the philosophy is like this. Radiation will control most of the time the local tumor. For example, breast cancer. Breast cancer is usually managed, especially in our setting. Most of the time, we get locally advanced cases. So usually, if the tumor is already very big, you do neoadjuvant tumor to shrink the tumor. To shrink neoadjuvant chemotherapy to treat the tumor. Or if the patient is not eligible for chemotherapy, we use radiation. Kasi maraming tumor sa atin, Cito, na malaki na eh. Hindi basta-basta ma-opera ng mga doktor. Then after that, usually hindi naman siya nakukuha lahat. Usually tinatawag namin ng mga positive margin. Tapos malaki yung tumor. Pag naghango, may kulani na. That means na maraming positive na kulani, most probably kumalat na yung tumor systemically and locally. So what radiation does is prevent that cancer from recurring again by exposing the part where the tumor came from. So yung radiation is a local form of a local treatment, while the chemotherapy will take care of the systemic spread. Kung meron na siyang napunta sa ibang parte ng katawan, chemotherapy bahala doon. Usually, doon sa operative site, radiation will take care of the local recurrence para hindi na siya umulit sa pinanggalingan.
Okay. Okay, now, Doc Goldie pala, parang
Yes.
Goldie Hon no? Doc Goldie, okay, can you take us through the steps? Kasi when my sister was writing about her journey, medyo hindi pala ganun kadali yun, no? I always felt, the emotions take over. But when you now have to sit down and go through the process, okay, first of all, there are tests to determine whether persons have cancer, Doc Goldie. What are these tests and when do patients have to take the test?
Mhm. So, as I said earlier, may mga cancers na can be screened or detected early, no? So, and I mentioned also that cancer can be prevented actually.
Mhm.
So there are 3 levels of prevention. The first one is the primary level, and this is prevention of cancer in a patient who doesn't have the disease. So
Okay.
this would involve knowing the risk factors for cancer and avoiding them. And also parang yung modifying your lifestyle so that you can avoid the carcinogens. Yun, wala ka pang cancer noon.
Mhm.
But if you already have cancer and it's not yet detected, then it can be detected by the secondary prevention, which is the screening. However, not all cancers can be screened early. Merong mga specific lang. For example, breast can be detected early by screening,
Mhm.
colorectal, cervical cancer, and even lung cancer nowadays. We already have a screening test, which is a low-dose CT scan for high-risk patients.
What about yung LMS?
Yeah,
Ito,
prostate pala, I
magpa-PSA
forgot.
ka.
Yes. Prostate is also one of the cancers can be screened early by
Mhm.
PSA and also digital rectal exam. Yung ipapalpate mo lang yung mass doon sa sa anus, yon. So, yun yung mga yon. So, when you detect it early, of course, you can diagnose it early and you can give the treatment and your goal can be cure. However, most of the patients that we have in the Philippines are diagnosed late. So, most of them come to us at least locally advanced. O kaya, marami pa rin metastatic din. Okay? So, for these particular patients, we still can prevent. The third level of prevention is actually the actual treatment of cancer. So, ito
Okay.
yung pagbibigay na ng chemo, ng surgery, ng radiation. So, you were talking about your sister, breast cancer ba siya?
Yeah, breast cancer.
Okay. So usually sa breast cancer, one of the recommended screening will be to do your palpation yourself. So self-breast examination yan, ikaw. So, and also starting at the age of 50, miski wala kang mapalpate, you should undergo mammography. Kasi mammography can actually detect tumors that are less than 1 centimeter that cannot be palpated by hand.
Mhm.
Okay? So kung napalpate mo na siya, then go to the doctor, especially if you are an older patient, mga 50 and above, even younger. We have been seeing younger breast cancer patients din eh. So go to the doctor and have this examined and evaluated, and usually the doctor would request for a biopsy. So yung biopsy niya, ang biopsy, we prefer more excision, yung tatanggalin siya. O kaya kung hindi excision, at least get a bigger tissue sample, like a core needle biopsy. Why bigger tissue sample? Because we have to do tests. Aside from determining the histopath or the biopsy of the tumor, may mga tests kaming ginagawa so that it can guide us in the subsequent treatment.
Okay, and all those well, first of all, the oncologists and experts are all are available or hold all clinics at Rizal Medical Center for our area here in Rizal and Region 4, correct? And Metro Manila.
Yes. All the
Okay. Yeah.
all the members of the multidisciplinary team, like radiation oncologist, medical oncologist, gyne-oncologist, surgeon are all available in Rizal Medical Center.
Okay, we'll go for a quick break, Dr. Ferrolino, Dr. Alonzo, and when we come back, I'd like to ask both of you to walk us through on screening options and treatment options available at Rizal Medical Center. We'll be right back here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran. And as already mentioned earlier, and our ongoing conversation is all about cancer, the disease cancer, the screening for cancer, treatment options, all courtesy of our friends at Rizal Medical Center. And we already talked about what are the top cancers in the Philippines, starting with breast cancer, lung cancer, and then ano na ulit yung third highest, Doc Goldie?
Colorectal cancer.
Colorectal. Now, we said that some cancers can be screened, some cancers will only be discovered much later when they are apparent, etc. Now, okay, so are the screening methods, facilities, services available at Rizal Medical Center and most public hospitals?
Yes. Yung sa Rizal, we have all the screening methods, especially in breast. We have already the mammography, breast ultrasound, and we have biopsy. We have ultrasound-guided biopsies already, no? And then for prostate, we also have yung ultrasound PSA, and also the digital rectal exam can be done as an outpatient basis. In cervical, we have the pap smear, and then yung pelvic ultrasound-guided biopsy also. So lahat actually we have the screening. And later on, siguro we will actually plan to have a parang screening clinic. Wala pa kami nun, pero later on, within the 5-year program that we have or plan, we hope to have it, yung screening clinic, para all-in-one na, nandun na, they just go to one clinic and all the screening tests will be availed there.
Okay, and as far as charges are concerned or costs are concerned, I know you are a public hospital and technically iniisip ng tao libre yan, but are there costs that are not covered by PhilHealth or whatever? Kasi parang ang cancer is still one of those diseases that is not covered completely in many HMOs, etc.
Mm-mm. So sa DOH kasi ngayon, di ba, meron na tayong universal health care
Yeah.
law. Oo. And that includes yung nga, coverage of cancer kasi one of the top nga diseases yung cancer. So, yung plan nila is to build cancer centers in the country. So
Yeah,
hindi
they're
lang
putting up
PGH.
one in UPPGH.
Yes, so aside from UPPGH, meron mga regional na rin. Okay. So sa government, actually, aside from PhilHealth, we also have other sources of assistance. One of them is malasakit. Yung malasakit kasi all-in na yun, parang one-stop shop ng financial assistance yun eh.
Mhm.
Aside from that, for the treatment itself, DOH is also very supportive in providing free medications or free chemo. Not only for breast cancer, it has already expanded to all the cancers.
Mm.
So ito ma-avail nila ng libre, even the most expensive drugs, as long as they are available, they can avail of this libre. For the
Okay.
screening, very minimal naman actually it can be covered by PhilHealth also.
Okay. Doc Tony, Tony ba? Doc Alonzo, baka Tony ako na Tony, hindi naman pala Tony. Dr. Alonzo, tanong ko lang, what as for your department or for your section, what services do you guys provide? Treatments, whatever, kasi ang dami, alam ko ang dami sa sa X-ray, sa radiation oncology, maraming ginagawa diyan eh.
So Cito, no, luckily we already have one of the most modern machine in the Philippines, ano. Comparable siya kahit sa mga private hospital. We have the machine capable of delivering radiation with strict conformality. Ibig sabihin nun, Cito, no, sa layman, ang tatamaan na lang ng radiation yung tumor. Yung paligid, halos yung paligid na hindi involved ng cancer, hindi na siya may expose. Ganun ang ka-high-tech ang machine natin ngayon sa...
Parang laser radiation?
Yes, laser, parang laser accurate, close to that, laser accurate. So what happens is, there's already very minimal long-term side effect for patients. So dapat yung mga pasyente hindi na natatakot. Wala na tayo sa vintage age na parang sabog. Tawag nila noon, narinig namin noon, yung combat na luma, sabog yung radiation, wala na tayong ganun ngayon.
Mhm.
It's very informal, very technical, very computer, close to AI na ang technology natin. And luckily, we were given such kind of machine.
But
So-
how does that translate to your patients? Because sad to say, at least in private hospitals,
Yes.
nagbenta kami ng lupa. Okay? May mga kaibigan ako, binenta yung kotse, binenta alahas, napautang, just to deal with cancer. Now, in a government hospital like Rizal Medical with this high-tech, almost laser radiation equipment, what's the cost to the patient?
So this is the good news, ito, no? For case rate patients, those with charity and those that goes to the Malasakit Center, services are almost technically 100% free. They will just use those who have PhilHealth that are under our case rate program, charity na with PhilHealth, wala na silang babayaran.
Mhm.
Just because also of the universal healthcare na all Filipinos will have PhilHealth.
Okay, Pilipino naman ako eh. No, I'm serious about that,
Yes,
Dr. Alonzo,
yes.
no? Because medyo it's become a sore point for the middle
Yes,
class. Na
Yes,
sinasabi ng mga kakilala nating middle class, kuya, ba't ganun? Porque ba may sarili akong bahay, dapat isanla ko yung bahay ko para lang mabuhay ako. What is the policy of Rizal Medical Center when it comes to every Filipino walking through, from the neighborhood?
Usually, kung kung hindi ka charity na pay, actually, Cito, mababa rin if ever na meron yung tawag namin doon, cash out, it's very minimal.
Mm-hmm.
You cannot compare it to the government. You cannot compare it to the private hospital, malayo.
Mm-hmm. Well, because that, para for transparency, this is one of the reasons why I support Rizal Medical Center, why I support the Philippine Children's Medical Center, and also the Heart Center, because of the services that your institutions render to all Filipinos. Kasi miyat-miya na lang, may lalapit sa akin, hihingi ng tulong, pero hindi nila naisip na pumunta ka muna kaya doon sa hospital. Sir, mahal. Yun lagi iniisip nila eh. Anyway, okay. So what other services, aside from that high-tech, robotic, AI type laser radiation machine that you have, ano pa yung mga services sa section mo?
Cito, we have another form of machine that can deliver radiation. So that is what we call brachytherapy. Radiation din yun, Cito. We still deliver X-ray. But this time, it is inserted naman on a cavity. For example, cervical cancer. Usually, we treat cervical cancer with radiation, yung sinabi ko sa iyo, yung linear accelerator, the one I previously mentioned, and we have to add a dose to the cavity of the cervix. We will put the radiation directly on the cervix. Because we cannot treat the patient with the external beam alone kasi we need a higher dose. Kumbaga sa kailangan natin ng dose. For example, Cito, ganito, kailangan natin dose na 80 doon sa cervix, 80. Ang kaya lang i-deliver ng radiation, 50. Kasi hindi na pwedeng lumampas doon, maapektuhan na yung pantog eh. At saka yung rectum. So, kailangan ilagay mo doon sa loob. Pag nilagay mo sa loob, at tatamaan niya na lang yung cervix.
Ito yung tinatawag nilang targeted.
Hindi rin targeted. Pwede rin yung external beam na targeted, pero mas targeted yung brachy kasi itatapat mo na eh.
Okay. Paano yung katulad ng liver cancer?
Ba naman yun? Ano rin yun? Meron din. Pero kasi ang liver cancer sa ngayon, pwede rin, yung machine natin ngayon, yung linear, yung una ko na mention, ang tawag naman na SBRT. Actually, software yun at saka training. Sa ngayon, wala pa tayo na. So, IMRT lang tayo.
Magkakaroon tayo niyan.
Magkakaroon tayo. Actually, naman ang projection. Tsaka darating ang time din, susunod namin kasi magiging brain center din yan eh. Susunod naman yung laser na sa brain. Yung maliliit na tubo sa brain, kaya siya i-treat.
Okay, naku, huwag ka na magsasabi tungkol sa brain kasi baka padala ko yan doon sa isang malaking building. Anyway, Doc Goldie, going back to your section, yung chemotherapy, that's your department, right?
Yes.
Okay, can you explain to our viewers, ano ba talaga yung chemotherapy na yan? Kasi may mga nako-confuse they confuse radiation versus chemotherapy.
Kasi yung sa treatment ng cancer, una-una kasi you have to remove the tumor. Okay, so yung tumor can be removed or can be parang addressed by surgery, and that is what you call loco-regional treatment. So it can be removed by surgery or radiation. You can use radiation to destroy the tumor cells locally. Yun. Ngayon, yung sa amin naman, sa chemotherapy, that is the systemic. Ibig sabihin ng systemic, we will address or we will target the tumor cells or the cancerous cells that are already in the blood. Yung nasa circulation na. Yung hindi mo na siya matatarget locally. Okay? So that's why you give chemotherapy. Yung chemotherapy kasi hindi lang naman yung chemotherapy na iniisip ng mga tao. Medyo marami siya. Ang chemotherapy, meron siya isang tinatawag namin na cytotoxic. Yun yung common, yun yung familiar sa mga tao na
ano yun?
Nakakakalbo. Yun yung mga nakakakalbo.
Pero ano yung klase ng chemotherapy? Paano ina-apply yun and para saan?
Ayun. Yung cytotoxic, actually, yung chemotherapy generally can be given. Pwede siyang IV sa suwero. Pwede rin siyang oral. Meron kami mga oral treatments.
So
Pwede
gamot
siya mga
siya,
injection.
hindi siya parang
Yes.
katulad sa radiation.
Yes, gamot siya.
Radiation is
Oo.
parang parang smart bomb eh. Di ba?
Yes, gamot siya na binibigay para ma-target yung mga cells na nasa circulation na hindi maabot ng surgery tsaka radiation.
Okay.
Pero ngayon kasi may mga bago na tayo, hindi na kagaya na dati na yung mga chemo, yun yung mga nakakakalbo, maraming side effects, nakakapagpasok ka. Meron na tayong tinatawag na targeted treatment.
Okay.
So ito yung mga newer modalities or newer treatment for cancer patients wherein we just target the specific tumor. So ang ginagawa nun, we identify a certain parang part of the tumor or like receptor. Tapos pag na-identify mo na present yung sa tumor, then you have a drug that matches to it. So specific siya. So for example, in breast cancer, meron kaming dinidetermine yung HER2 new receptor. Part yun ng ng kuha namin eh. Part yun ng sa diagnosis ay sa staging also. We determine the HER2 new receptor. If it is present on the tumor, meron kaming certain drug that is anti to the HER2. So it's an antibody against the HER2 new receptor, and this drug is your trastuzumab. Ito yung tinatawag na Herceptin. Ito yung mahal na drug. Okay? So if the patient receives that, tas ang tumor niya, HER2 new positive, mas malaki yung survival niya. So yung gano'n ang ginagawa ng targeted.
Okay. Now, bakit ang tagal? Bakit inaabot ng 1 year to 2 years yung treatment? And medyo yung iba nga, like my sister, she already had ano bang tawag mo doon? Parang may port or something.
Basically, yung inaabot na matagal, maybe siguro advance yun, no? Pero pag mga mga early stage, so yung basic na the steps that the patient goes through is first to remove the tumor by surgery.
Yeah.
Second is to give the chemotherapy or the drugs para hindi na bumalik yung tumor. And then third, radiation kung kailangan niya ng radiation, especially if positive yung mga kulani sa kilikili or lymph nodes. Tapos, and then put the patient on oral treatment if positive then yung mga hormonal receptors niya like estrogen and progesterone. So basically, yung oral hormonal treatment will take mga at least 5 years yun eh. Pero iniinom lang naman yun. Ngayon, for the locally advanced, yung tumatagal minsan kasi, like locally advanced or at least metastatic, yung locally advanced, nauuna yung chemo kaysa sa surgery. Bakit nauuna? Kasi
Yun nga, okay.
Yes.
I've heard of cases like that na sinabihan ng oncologist, mag-chemo ka muna. Teka. Bakit
Yes.
pinauna yung chemo? Ba't hindi muna tanggalin yung cancerous cells,
Yes,
etc.?
Oo. Nauuna yung chemo sa locally advanced kasi usually malalaki yung mga bukol nila eh. Tsaka meron ng involvement sa mekulani na sa kilikili. So we don't know if meron mga cancer cells na nasa blood na. Kasi once nasa kilikili yan, baka pwedeng meron nasa blood. So pag inuna mo yung surgery, baka mahuli ka. Kasi pag nag-surgery ka, it will take mga siguro 4 to 6 weeks para to recover bago ka makapag-chemo. And also one reason we give chemo before the surgery is to decrease the size of the tumor. Para pag nag-surgery ka na, mas maganda yung outcome ng surgery mo.
At saka mas
Longer
mas
survival
accurate kung alin yung tinatanggal mo.
Yes, tsaka longer survival siya. It has been proven na if you give chemo to a patient na locally advanced, longer ang survival din.
Okay.
Especially yung mga aggressive tumors.
Okay, Dr. Alonzo, looking at all the equipment you have, parang ikaw yung the favored one eh. Kasi puro high-tech yung equipment mo dyan eh. Ang tanong ko, meron bang klase ng cancer that with all your high-tech equipment, parang Goldie, sa'yo yan, hindi sa amin yan. Is there a type of cancer na cannot be dealt with radiation?
Usually, Cito, very, no? Most of the time, siguro sabihin na natin, actually, kahit ang sabi ng World Health Organization, kailangan dumami ang facility kasi 80 to 90% ng cancer, may role ang radiation therapy. I'm not saying na we can cure it, but we have a role, which means that we can enter as neoadjuvant, kagaya ni Dr. Galdi, unahin muna yung radiation bago mag-opera o mag-chemo. We can enter as definitive, which means definitive, we are targeting cure for cancer. And third, we can also enter as palliation. Ibig sabihin, kumalat na sa buto, kumalat na sa brain, then that is already what we call a stage 4. So that doon very evident din ang role ng radiation because we can palliate the patient. Maybe we cannot treat the patient, but we can improve the remaining quality of life for the patients. One, radiation will be very good in relieving pain, especially for bone metastasis. And it very effectively control bleeding. Kapag masyado lang malaki dumating ang pasyente, masyado lang malaki yung tumor, we can control the bleeding. And after controlling the bleeding, then the patient can opt for other treatment. Because unless you control the bleeding, then we cannot do anything for the patient. So almost every aspect of goal of treatment, merong role ang radiation. May it be definitive, sabi ko, yung target natin is cure. May it be palliative, yung hindi na tayo makaka-cure dahil kumalat na, but at least we can relieve the pain. We could be neoadjuvant, that means yung uunahin muna, or we could be adjuvant, gagawin siya ng radiation after na matapos ang chemo at saka opera, kagaya sa breast.
Okay.
So, hindi mawawala ang radiation.
Okay. Now, Doc Goldie, may I ask, what about yung tinatawag nilang mga blood cancers? Totoo ba yun? Kasi ang alam ko lang, leukemia. Meron din mga nagsasabi na yung parang skin cancer, etc. Could you talk a little about those things?
Actually, cancer kasi involves a lot of organs. No, yung I mentioned kanina, yun lang yung mga top 3, no? But we have a lot of cancers already involving, and one of them is yung blood cancers nga sinasabi mo. Not only leukemia, marami pa yan eh. Meron din yung sakulani, lymphoma, meron din multiple myeloma, yung parang part of the blood din, and so on. Sa Rizal Medical Center, meron kaming specialty na nag-address dyan. Yung hematology namin, adult hematology and pediatric hema-oncology.
Ayun, kasi pagkaalam ko sa hematologist, blood diseases lang. Pati pala yung mga blood cancers falls under hematology.
Yes. Yes, sila din yung nag-treat noon. Meron kaming ganyang specialty.
Okay, what is the bigger headache? Juvenile leukemia or adult onset leukemia?
Actually, adult onset leukemia has a poor prognosis compared to juvenile. Most of the juvenile leukemia can be cured with treatment. Meron lang mga iba na medyo high risk or mataas yung mortality, like when you have leukemia less than 2 years old. Yun, medyo mataas ang mortality. No? But generally, they can be cured. But in adult, of course, leukemia, depending on the type.
How do you treat juvenile leukemia? Kasi nakikita lang namin lagi, pag pinapakita sa TV, nananawagan po kami, ganito, ganon. Pero parang no one ever talks about the post-treatment scenario.
Actually, ang juvenile leukemia kasi matagal ang gamutan eh. Meron kang induction. So the first series of chemo that you give, you have also a maintenance phase. You have a consolidation. So after na induction, meron ka pang i-add para hindi bumalik. And you have a maintenance phase.
So
and
puro gamot yun?
Oo, puro gamot yun. Okay. Medyo matagal, kaya siguro nananawagan kasi nga, matagal yung treatment. So this would incur, of course, expenses. Okay. But in RMC, we have the medications. Meron kaming mga chemo for that.
Okay, now, so we're about to, I think we're running down to our last 3-4 minutes here. Now, for those who have adult onset leukemia, what are the triggers for that, Dr. Goldie?
Actually, sa med ko hindi namin specialty yun, no? Pero
Yeah.
what I see sa mga nakikita ko, no, triggers are like risk factors, ganun ba yun?
No, I mean, what causes? What
Ayun, yun,
causes
sa mga
adult
causes.
onset?
So generally, parang yung nakikita ko sa mga, some of them may be genetic.
Mm-hmm.
So merong mga certain mutations in the blood can be inherited.
Mm-hmm.
The body that can be inherited. But some of them, they are exposed usually to chemicals, like in the workplace. Yung nakikita ko mga exposure nila.
Ayun,
yung mga
okay.
chemical.
Kasi I've heard of cases na yung mga mataas ang ganyang kaso doon sa mga nagpipintura ng mga sasakyan.
Yes, nakikita ko yan. Ng mga nagpipintura.
Chemists, people who have direct contact with chemicals, etc. Mas mataas yan.
Also, exposure to radiation then actually can cause. Oo, radiation. Like,
paano na si Dr. Alonzo?
Yes, actually merong konting carcinogenic effect ang radiation.
Doc Alonzo, ano ba yan? Kasi...
tama naman si Dr. Galdi, merong risk, pero it's very minimal, at saka the risk will always outweigh the benefit, lalo sa age ng conformal therapy. For example, sa breast, meron din naman risk sa breast, usually, cancer na yung sarcoma, if ever, pero usually, ako sa totoo lang, sa practice ko, siguro 1 pa lang yung nakita ko, pero that was 20 years after. 20 years after the radiation. But to think of it, if you didn't treat the breast, it might have occurred within 1 to 2 years sa primary site niya. So if it occurs sa primary site, parang uulit-ulit siya ng treatment niya ng breast cancer.
If I may add, Cito, yung risk actually increases sa mga bata.
Yes, mas common sa bata.
Pag exposure sa bata, mas mataas ang risk.
So, yung mga batang obligadong pa-x-ray ng pa-x-ray is at risk?
Pwede, yeah. They may be at risk also.
Yung mga may TB, yung mga merong... ano yung bone cancer ba, Doc Goldie?
Pag sinabing strictly bone cancer, yung tinatawag na osteosarcoma yun eh. Pero meron kasi mga sinasabi din sila na nire-refer nila as bone cancer na actually hindi naman galing sa bone. Parang metastasis silang to the bone.
Ayun. Okay. Pero yun yung sinasabi ni Doc Tony kanina na pag gano'n na kumalat na yung radiation therapy. Therapy na ang tawag doon, Dr. Alonzo, no? Na para hindi masyadong masakit.
Yes.
Okay.
Yes.
Well, it's good to know that in spite of being a stereotype na government hospital, Rizal Medical Center probably has some of the best and better equipment than some private hospitals in the country. And they are staffed, the hospital is staffed with experts such as you, Dr. Ferrolino, Dr. Alonzo, and it's really good to know that you are our go-to facility for medical questions and public education. And thank you for joining us in this Cancer Awareness Month. Kasi po mga kaibigan, we always think mahal, we always think kamatayan na, hindi po. Fight lang tayo, may kakampi tayo in places like Rizal Medical Center. Dr. Ferrolino, Dr. Alonzo, thank you very much for your time this morning.
Thank you very much also. Thank you. Thank you, Cito.
Okay, God bless both of you. And that's our interview for this morning. Let's now go to our closing prayers for the day. And it is from the book of Psalms 19, chapter 19, verse 14. Let the words of my mouth and the meditation of my heart be acceptable in your sight, O Lord, my strength and my Redeemer. Thank you for joining us this morning here on Agenda. I pray that you will go visit your doctor to have your annual checkup. Please check for cancer, etc., especially if you are in that age or in that bracket of risk. Thank you, and please keep it here on One News.